My name is Dr. Sandra Dorman, and I'm the Director of the Centre for Research in Occupational Safety and Health. Today, on the Northern Ontario Community Immunity Series, we'll be talking about how you can protect yourself against COVID-19. For the entire series, please visit our website at crosh.ca. To talk about protecting yourself, we first have to have a little bit of understanding on how COVID spreads from person to person. COVID-19 is a respiratory illness, and so when you get sick, and especially if you develop symptoms of the illness, your body is actively producing new virus particles that are being blown out through your nose and through your mouth when you're talking, when you're coughing or sneezing, even just when you're breathing, you're producing virus particles. And another person who encounters those virus particles can then become sick. Certainly, a person who has symptoms of illness are typically producing the most amount of virus particles that they can then spread to other people. But people who have COVID can also spread virus just before and just after they're having symptoms of the disease. And in fact, some people can get COVID disease and have no symptoms, but still be producing virus and spreading it to other people. And so in that sense, although certainly people who have illness, we know they're infectious, a person can look like they don't have illness and still be infectious. So we have to be cautious. The other thing that you should know is that the virus particle is predominantly being communicated through the air. I'm exhaling it. Sometimes, you can imagine if I sneeze, a lot of water droplets, and some of those droplets may fall to the surface, and I could touch those droplets and contract the disease that way. But the predominant way that the research shows that people are actually contracting the disease is through the air. Very small droplets or virus particles are floating in the air, and another person is inhaling them and getting infected. One other piece of information I want you to consider, which is something we call high risk associated with the 3 C's. So crowded spaces, close contact, and confined spaces. Obviously, if you go somewhere where there are a lot of people and you don't know the vaccine status of the people, the more people in the room, the more crowded it is, the more chance that there's somebody there that has the disease who might be spreading it within the environment. Okay, so that's a high risk. Close contact is also a high risk because if you imagine somebody that has the disease is actively producing virus, most of the virus is going to be close to that person's head, and then it's going to diffuse out. And so if you're in close contact with a person, that's a high risk situation. That's why we typically recommend distancing of 2 meters is to try and not be as close to the person. And then the third piece is a confined space. I like to use the example of cigarette smoke. If you're in an enclosed room and one person is smoking within the room, you can see how the cigarette smoke is both accumulating first around where the person who's smoking is, but then it is slowly spreading throughout the room, and eventually everyone in the room can smell it. That's essentially the same thing that's happening with an infected individual with COVID-19. A person in an enclosed space is actively producing virus particles that is staying up in the air and is slowly floating throughout the air in the room, which means that anybody else in the room also has the opportunity to inhale that virus and become infected. And this is why, we talk about the importance of good ventilation and good airflow so that you reduce that accumulation of virus within an enclosed space. So those are our 3 risk places. And of course, you can see now that these are classically places you're going to encounter when you're at work or when you're at school or when you're socializing or going to, out for a meal. Exercising, so these are pretty common scenarios. Understanding all of that, what can we do to protect ourselves from contracting COVID-19? Well, the very first thing you can do is get vaccinated. All of the vaccines that Canada currently has approved are highly effective. at both reducing the transmission rate of COVID from person to person, but also reducing the severity of the illness that a person might get if they contract COVID. Being vaccinated can prevent you from picking up the virus, but even if you do pick it up, right, because breakthrough infection can occur, the time frame that you're actually infectious for is much smaller. And so you have a much smaller risk of passing on the disease to somebody else. So vaccination is our best method to protect yourself from COVID. The second thing you can do is get tested. If you feel ill, if you have the symptoms of COVID, you should immediately self-isolate, stop interacting with other people and get tested, and wait until your test results come back in before you interact with other people again. If your test result is positive, you should continue to self-isolate and quarantine to reduce the transmission to other people. The third thing that we can do is adopt personal protective measures. The best example, the most common example of this is our face mask. And in that sense, the mask is our last line of defense. If there is a person in your environment who is actively producing COVID and breathing the viruses on you, it is the mask that is protecting your airways, that is preventing you from inhaling the virus. Particularly in a close contact situation or a high-risk situation, you can also wear eyeglasses or a face shield. That's predominantly protecting you from droplets that may come into contact with your face. But in the same sense, we should probably be thinking about the 3 C's again and our decisions about personal protective equipment that we may want to use. So, are we in a crowded space? Remembering that a crowded space is higher risk. Are we in close contact? So we may want to up our level of personal protection if we are constantly, or if we are in a place with close contact with another person. And then, of course, are we in a confined space? Ideally, can we avoid the confined space? If we can't avoid the confined space, can we improve the ventilation within that space? Can we reduce the total amount of time that we're going to spend within that space? And can we perhaps put into place filters to filter the air, similar to wearing our mask, for that space as well? That is it for how to protect yourself against COVID-19. Next up on the Community Immunity series is how do vaccines help my immune system protect me against COVID-19? I'd like to acknowledge the Natural Sciences and Engineering Research Council for funding the Northern Ontario Community Immunity series, and I hope to see you again. Thank you.